Hi, this is for nasotracheal suctioning. So the first thing we want to do is go to the patient's chart, make sure that the order is in place, and then gather our supplies. You want to make sure your suctioning is available in the room, that there's also oxygen set up and oxygen available in the room for the patient, and you have a sterile suctioning kit. So I'm going to go to the patient's room. Hello, Mr. Blank. My name is Trisha, and I'm with Respiratory Care Team. Today we're going to do some suctioning through your nose. Sounds like you're having a little bit more secretions than what we would like, and we're going to help you remove those. I see you have that nasal airway in place, so we're just going to help you get rid of some of those extra secretions you've got there. Can I get your name and date of birth? Okay. So then the first thing we're going to do is we're going to give you some oxygen because we want you to stay good and oxygenated through this procedure here. So we're going to apply oxygen to the patient. Then we're going to assess our lung sounds, get vital signs. Mr. Blank, I'm going to put this pulse oximeter on your finger, and I'm going to leave it on your finger through the whole thing. If we notice a drop in the oxygen level, we're going to stop what we were doing and increase that oxygen for the patient. So we're hyperoxygenating him. We're turning on the suction. The suction is going to be turned to negative 100 to 120 because he is an adult. And then we're going to go ahead and open our supplies. So we have our sterile suctioning kit that we open. We're going to put our sterile gloves on. We want to maintain one sterile hand and one clean hand. So this will be my sterile hand. So then we are going to remove the catheter from the kit. We are going to make sure we have our saline ready. We have some normal saline that we're going to use, and then we also have lubrication for the catheter itself. So then we are going to put the lubrication either on the palm of our hand or on the lid of the sterile kit so that it remains sterile. So we've got the lubrication ready. Now I'm going to connect my suction, and I'm going to make sure it's working. So you would want to put the tip of your catheter into the sterile saline and include the thumb port. At that point you should see the sterile saline coming up through the catheter to ensure that the suctioning is working. So our suctioning is working. I'm going to go ahead and lubricate the tip of that. So we've got that lubrication on there, and Mr. Blank, I'm going to remove your oxygen, and we're going to go ahead and get started. I will instruct you to cough if it doesn't make you cough while we're doing this. So just nice, easy breathing, and just relax as much as you can for me. So at this point, we want to advance the catheter into the nair. We do not want to include the thumb port. So we would advance that into the nair. As we are going, we're going to meet some resistance. That's when we would instruct the patient to cough. Go ahead and cough for me, Mr. Blank. And then we would advance a little further until we meet the second resistance. That is the carina. At that point, we're going to pull back slightly, occlude the thumb port for suction, and then we're going to start twisting and pulling back the catheter. This suction piece should only last less than 10 seconds. The entire process should be less than 15 seconds. So we've gone ahead and removed that. Let go of the suctioning. Mr. Blank, I'm going to go ahead and feel your chest one moment again just to see if we've removed all those secretions. If there are secretions present, you would go ahead and advance again. We only want to do this twice in one setting, so only 2 times max. Patient is cleared of the secretions. Let's go ahead and put that oxygen back on. So we would put oxygen back on the patient for a minute following this procedure. Discard our supplies here. Get vital signs again, listen to the breath sounds. Make sure we're monitoring that oxygen level. He's got his oxygen, so we'll remove that oxygen, turn off the suctioning, answer any questions that Mr. Blank may have, make sure he's comfortable, he doesn't need anything, and then we would document in the chart everything we've done. Thank you.